What has impacted me the most in the reading so far is learning about the determinants in healthcare. Some of the determinants are as simple as not having access to healthy food. I've witnessed this within my own family. Having to grocery shop at the dollar store, I noted that many of the food items that my family was buying was not of good quality and full of preservatives. Eating food of this type can lead to health issues such as diabetes mellitus and hypertension. I also found it interesting how the housing department plays a role in health determinants because poor housing can lead to health issues such as exacerbated asthma, skin rashes, and lead poisoning. I now have the understanding that healthcare policies go beyond just the CDC. With the Health and All Policies strategy, health is considered in many other policies. Some of the agencies at the federal level that help healthcare are the Environmental Protection Agency with environmental health, the Occupational Safety and Health Administration for workplace safety, the Department of Homeland Security for disasters and terrorism, the Department of Agriculture for food supply, the Department of Housing and Urban Development for building requirements, and the Department of Energy for radiation safety standards. Interestingly, healthcare can be improved with the help of medical legal partnerships, or MLPs, by providing services for health-related legal issues. Teitelbaum and Walensky noted that MLP is beneficial because one such study focused on home visit nurse-based interventions for prenatal and postpartum patients demonstrated better prenatal health behaviors, better pregnancy outcomes, lower rates of child abuse and neglect, and higher rates of maternal employment among participants as a result of the MLP services. It should also be noted that multiple articles have addressed how MLP can benefit practitioners and patients alike through interdisciplinary training and education. Teitelbaum and Walensky do a good job at showing how legal care can be framed as health care, such as helping to appeal denials of food stamps, securing housing subsidies, securing specialized education, clearing credit criminal status, and securing restraining order for domestic violence. The importance of providing this aid is to ensure that all individuals have better access to health care. Once everyone has access to health care, our nation will be healthier. Teitelbaum and Walensky noted that if healthcare is at the core of well-being for all people, then reducing barriers to good health should be an obvious societal goal. And for low-income and other vulnerable populations, this means reducing the health-harming effects of social conditions that they struggle with disproportionately. God has given us the ability to have laws that can be beneficial to all. Let everyone be subject to the governing authorities, for there is no authority except that which God has established. The authorities that exist have been established by God. Romans 13:1.